The three biggest issues for small businesses when it comes to healthcare are cost, cost, and cost.
The cost Arensmeyer is talking about works out to be 18%. That's the extra cost small businesses pay over large businesses when they choose to offer health insurance to their employees. Arensmeyer spoke at the Chamber's August Healthcare Forum for Small Business.
Over the next 10 years, healthcare costs for small businesses are going to increase by $2.4 trillion nationally. That is trillion with a T. That wages will be depressed by $835 billion. Profits will drop by $52 billion, and 178,000 jobs will be lost.
We find it very difficult to compete with those kinds of people on rates. And so when our clients look at the rates, they'll say, well, you are, 40% more expensive. I can argue that, well, the person I'm giving you does not have to worry about where their health care is coming from. They'll pay more attention to you. They'll give you better service, but it's hard to make up 40% difference. So I think the way it's set up now, the access and the cost place an undue burden on the firms that go ahead and do it. And there's a competitive impact, and it's negative for the firms that do it.
In a perfect world, if we could start over, we would never have health care tied to employment. I mean, that's one of the reasons we are in this mess today. And the reason we have job lock and entrepreneurship lock is because we have this unhealthy or unholy alliance between employment and health care, which we all know grew out of World War II.
Arensmeyer told Chamber members it wasn't yet clear what would happen in Washington.
Potentially a co-op, a nonprofit co-op option instead of a public plan. And that there'll be no direct employer requirement, but there'll be a possible free rider provision, which will require employers whose employees get subsidies to buy into buy insurance, and this doesn't include Medicaid recipients, that they'll have to repay the government for those. But that, I believe that what we've heard is it's only going to impact businesses of 50 or more employees.
The ostensible reason to have a public plan, according to its advocates, that we need additional competition. Now, I'm a former antitrust official. In a former life, I worked at the Justice Department and spent my time prosecuting people for violating the antitrust laws. And so I spent all my time worrying about competition. And I can tell you, looking at this health insurance market, there are hundreds of health care plans in this country. And if you add to that all the large companies, which basically self-insure, in my view, the only impediment to competition are existing laws that prohibit insurance companies from selling insurance across state lines. If we had a true national market in health insurance and then regulated the solvency of health insurers at the federal level and got out of this state-by-state business, we'd have all the competition you'd want. There is absolutely no need for a public plan. And the only thing we need is that we need subsidies for people that can't afford it. So in my view, we can have a perfectly competitive healthcare system, privately run, with subsidies. Now, there are a lot of reasons why maybe the administration and why the Democrats have chosen to have this public option. It's sort of a fallback from the single-payer idea, which a core part of the Democratic Party has always wanted. And there is this, I think, religious, semi-religious antipathy to insurance companies. And all of us have had problems with insurance companies. But the fact of the matter is, the reason why insurance companies deny people coverage with pre-existing conditions is not because they're evil. It's because they can't make money. It's very simple. If any of us were to run a business, if all we could do is take sick people, we'd be out of business. And so the only way you can make an insurance market work is if everybody's in the pool and you have a mandate.
Let's try to focus on what's there now and improve it rather than trying to, start from scratch. We do need to forge an acceptable compromise on this issue of the public option, which has really dominated the discussion.
So if you think the debate about health care today is full of anger, angst, and so forth, wait till we have the mother of all debates about what to do about Medicare. And I think the only way we're ever going to get out of this mess, fiscally and also as a nation, is to be able to revisit Medicare in a way that says existing beneficiaries are protected, but that future generations, namely our kids, are going to have to live under a different benefit regime than the rest of us. And it's one of the things I tell my kids, and I advise you to tell all of your kids, that they are going to be inheriting a world that unfortunately we contributed to. We piled on benefit after benefit after benefit without the taxes to pay for it. And the day of reckoning is coming. And our kids are going to have to face it. And the only way out of it is either to raise taxes extraordinarily, which I don't think there's any public sentiment to do, or to change the benefit structures of Social Security and Medicare to make them more affordable.